Hello, everyone. Welcome to the News Browse News broadcast. CTV News reports that nurses in British Columbia and the Health Employers Association of BC have successfully reached a tentative agreement, thereby avoiding a potential strike. This breakthrough follows an overwhelming 98.2% strike mandate from union members last week, after 6 months of intense bargaining where benefits were a significant point of contention. Adrian Gear, president of the BC Nurses Union, stated that the strong strike mandate empowered the committee to negotiate harder and secure substantial improvements. The proposed agreement includes enhanced benefits coverage, access to enhanced mandate monies, in addition to regular wage increases, and new measures aimed at preventing workplace violence. Furthermore, the bargaining committee also secured significant additional funding from the province's health ministry specifically for implementing minimum nurse-to-patient ratios. Union members are expected to vote on ratifying this agreement in mid-June. CTV News reports that British Columbia's Public Safety Ministry is significantly expanding the use of its Health IM mental health screening tool to Royal Canadian Mounted Police, Mounties, in the BC interior. The tool, already implemented in other areas of the province, including the Boundary, Okanagan, and West Kootenay regions, will now be rolled out to the Thompson and Shuswap regions starting Wednesday. The province is investing $2 million annually to the BC Association of Chiefs of Police to support the widespread adoption of Health IM across municipal police departments and RCMP detachments. Harwinder Sandhu, a member of the Legislative Assembly for Vernon-Lumby, emphasized that this digital public safety tool empowers police to make informed decisions on whether individuals in crisis require transportation to an emergency room or can be redirected to more suitable community-based services. Furthermore, she noted that Health IM enhances the quality of information collected by officers and improves the safety of healthcare workers by providing clear communication, including flagging potentially violent behavior. RCMP Superintendent Michelle Tansey highlighted that the implementation is enabling officers to offer a more compassionate crisis response, recognizing that police are increasingly serving as first responders to mental health and substance abuse crises. The tool is also utilized by police in Prince George, the East Kootenays, Port Moody, Nelson, Delta, and Surrey, and is available in Alberta, Saskatchewan, Manitoba, and Ontario. The Canadian press reports that an Ontario resident who recently returned from Ethiopia has tested negative for Ebola, according to Canada's Chief Public Health Officer, Dr. Jos Reimer. Dr. Reimer emphasized that the risk of the virus affecting people in Canada remains low. In response to the ongoing Ebola outbreak in the Democratic Republic of Congo, Canada has implemented new border screening measures, which came into effect on Wednesday. These measures include increasing staff at common entry points and asking travelers detailed questions about their recent travel history and any symptoms they may be experiencing. Quarantine officers will also be stationed at the border to assess individuals flagged during the screening process. Dr. Reimer noted that while decisions regarding a travel ban are made by Cabinet, her advice is based on a very fluid, rapidly evolving risk assessment, including whether the virus is spreading beyond its current concentration. The World Health Organization's Director General, Dr. Tedros Adhanom Ghebreyesus, stated in Geneva that the risk of Ebola in the affected region is now very high, with nearly 750 suspected cases and 177 suspected deaths, though the global risk remains low. A recent poll conducted by Research Corbo in partnership with United Way BC highlights the significant impact of rising food costs on British Columbians. The Global News reported survey found that nearly one-third of residents are experiencing increased financial stress, leading to substantial changes in their eating and shopping behaviors. More than 35% of respondents have switched to less expensive generic brands or altered their diets due to unaffordability. Alarmingly, 21% have reduced their own lunches, 12% have cut back on medications, and about 4% have reduced meals for children. A significant portion of younger adults, 41%, and middle-aged individuals, 36%, admit to modifying their diets specifically because certain products have become too expensive. This financial strain is leading to more than 1 in 5 people eating smaller meals, and approximately 15% skipping meals altogether. The poll also indicates that 15% of British Columbians have accessed food from community organizations or food banks. Aljbo Sabova from United Way BC emphasized the urgency of these issues, stating that widespread changes to diets and skipped meals are particularly concerning. She called for collaborative efforts between retailers, governments, and nonprofits to address food affordability and security comprehensively. Global News reports that the Ontario government has officially lifted its week-long freeze on all Freedom of Information (FOI) requests. Senior civil servants responsible for processing these requests across the provincial government were instructed to pause their work while new guidance rules were developed. Premier Doug Ford downplayed the significance of the pause, claiming that only the media party was concerned with transparency rules. However, data from the Information and Privacy Commissioner of Ontario for 2024 indicates that media organizations filed only about 4% of the 27,000 total requests. The vast majority of OI requests during that period came from members of the public, businesses, and individuals using agents. The freeze, communicated via Microsoft Teams, drew criticism from opposition leaders, with Ontario NDP leader Merritt Stiles stating that the government was using recent controversial changes to FOI laws as an excuse to block access to information. That's all for this video. Thank you for watching. See you in the next video.